Good evening. Today we are going to do MCQs of ophthalmology. Ophthalmology is a very important subject. At least 12 questions come from ophthalmology in the Neet PG and the INICT exam. Let us begin with the first question. Shifting fluid is seen in. Shifting fluid is seen in A. Retinal dialysis, B. Tractional retinal detachment, C. Regmatogenous retinal detachment, D. Exudative retinal detachment. So the correct option here is exudative retinal detachment. What happens in exudative retinal detachment, ERD, which is usually caused by a choroidal tumor? It is characterized by shifting subretinal fluid. Shifting subretinal fluid. Whereas in tractional retinal detachment, the retinal mobility is severely reduced and shifting fluid is absent. So shifting fluid is seen in exudative retinal detachment. Please click the link in the description box to join the ultimate NEET PG event Breakthrough Blueprint Masterclass. Let us move on to the next slide. Esotropia is most commonly associated with esotropia. What do you mean by esotropia? Now let us look at the four options. A. Astigmatism. B. Hyperopia. C. Myopia. D. Presbyopia. The correct answer here is hyperopia. Hypermetropia is defined as the parallel rays of light coming from infinity are focused behind the retina when accommodation is at rest. The complications of hyperopia are recurrent stye, blepharitis, chalazion due to frequent rubbing, accommodative exotropia, excessive use of accommodation to see near vision, amblyopia, hypermetropia. Hypermetropia is more amblyogenic than myopia. In hyperopia, there is a high risk to develop primary angle closure glaucoma. The high in and the eye in hypermetropia is small and relatively shallow anterior chamber. Now, the ocular associations of myopia are primary open angle glaucoma, divergent squint, etc. So, the correct answer is esotropia is most commonly associated with hyperopia. Incongruous homonymous hemianopia with vernix hemianopia pupil. What is the site of lesion? A. Optic tract. B. Optic nerve. C. Visual cortex. D. Optic radiations. The correct answer here is optic tract. The field defects in optic tract lesions are homonymous contralateral incongruous hemianopia. Homonymous contralateral incongruous hemianopia. A 65-year-old man with history of diabetes and hypertension presents to OPD with complaint of diplopia and squint. On examination, secondary deviation is seen to more than primary deviation. Which of the following is the most probable diagnosis? A. Concomitant squint. B. Paralytic squint. C. Restrictive squint. And D. Pseudo squint. The correct option here is paralytic squint. Please like, share, and subscribe. Photos test to differentiate between pathology of which two structures? A. Lens and cornea. B. Retina and vitreous. C. Retina and optic nerve. D. Macula and optic nerve. The correct answer here is macula and optic nerve. Photostase testing is a gross test of dark adaptation in which the visual pigments are bleached by light. This causes a temporary state of retinal insensitivity perceived by patient as a scotoma. It also differentiates visual loss caused by macular disease from that caused by optic nerve lesion. So the correct option here is macula and optic nerve. A 40-year-old woman with bilateral painful proptosis with restricted ocular movement and chemosis. She is euthyroid. What is probable diagnosis? A. Orbital lymphoma. B. Orbital cellulitis. C. Thyroid eye disease. D. Pseudotumor of orbit. It is thyroid eye disease. Thyroid eye disease is the most common cause of bilateral proptosis. It can occur with thyroid status. The most common cause of unilateral and bilateral proptosis in adult is thyroid eye disease. The major clinical risk factor for developing thyroid eye disease is smoking. Women are 5 times more likely to be affected than men. It is associated with any thyroid status. It can be hyper, hypo, euthyroid. In fact, about 10 to 25% cases, thyroid ophthalmology occurs in the absence of both clinical and biochemical evidence of the thyroid dysfunction. So the correct option is thyroid eye disease. This movement, see the movement. This movement is lost in what you can see. It is lost in third nerve palsy. Levo elevation. Elevation of both eye towards left is shown in the illustration. This is lost in third nerve palsy. Unilateral proptosis with bilateral abducent nerve palsy is seen with A. Thyroid ophthalmopathy, B. Retinoblastoma, C. Cavernous sinus thrombosis, D. Orbital subretinal. Correct answer here is cavernous sinus thrombosis. The cavernous sinuses are irregularly shaped, trabeculated, consisting of incompletely fused venous channels located at the base of skull in the middle cranial fossa. They lie on either side of cella dorsica, are just lateral and superior to sphenoid sinus, and are immediately posterior to the optic chiasma. So the correct answer here is cavernous sinus thrombosis. Presence of extra layer of cilia posterior to gray line is trichiasis, dischiasis, extra layer of cilia. It is dischiasis. Extra row of cilia at the opening of meibomian gland posterior to gray line. It is also called as second row of eyelashes. Trichiasis is inward turning of previously normal lashes. Poliosis, localized patch of gray or white hair due to lack of pigment in the epidermis. Madarosis, decrease in number or complete loss of lesions. Which layer of cornea helps in maintaining hydration of stroma or cornea? Endothelium, epithelium, stroma, Descemet membrane. Endothelium. Endothelium thickness is 5 micrometer. It consists of single layer of flat polygonal cells. This endothelium is the most metabolically active layer, contains an active pump mechanism to maintain corneal dehydration.